We're doing a test that's a molecular-based PCR, which is one that we will do a nasal swab and send that to the laboratory. And what we're looking for there is acute or active infection. If you come into the clinic and you are presenting with symptoms of COVID-19, we're generally going to do that PCR test for active illness. Now, the antibody test that we do an IgA, an IgM, and an IgG. Now, the IgA and IgM may very well find an active infection, but as a general rule, that takes about 7 to 10 days to show up after you have been exposed. A lot of times people have said, hey, back in January or February, I was really sick and they really couldn't find anything wrong with me and they gave me antibiotics and I really didn't get any better. And I wonder if I had COVID-19. And so that IgG test, that antibody screen, it's a serology test, a blood draw, will tell us, did you in fact have COVID-19 or were you contacted with COVID-19? And that's really important because down the road, as we continue to study COVID-19, that'll let us know potentially if you have any immunity or not. We still don't know whether that IgG test or the development of IgG antibodies is going to convey immunity, but we certainly hope that it will. Antibody test is really very simple. You're going to come into the clinic. We're going to treat you like we would any other patient. We're going to screen you and bring you in and triage you and get your vital signs, and we'll do a brief physical exam on you. And then this is a simple blood draw, just a very small amount of blood that is drawn and then is sent off to the lab. It takes roughly 1 to 3 days as a general rule for that test to come back. The antibody screen it's something that we just began offering not too long ago, just as soon as it became available. And we think it's so important for people to come and have that test done because it lets them know that they have potentially come in contact with or actually been sick with COVID-19. And so that helps them knowing that, yes, that's exactly what I did have, and I may very well have immunity going forward. We don't know that yet. This is still, as you know, very early on in the process. And so there's still a lot of studies being undertaken at major universities as well as the CDC to take a look at, are we developing immunity? And the testing that we're doing will help with those studies to determine whether or not we're actually developing immunity, particularly when we go back into the flu season and the cold, the cold and flu season in the fall. It'll be very important to know who was tested, what their test results were, and do they get sick again or do they avoid that illness again? And so all of that will help in the aggregating the data for those studies. So it helps not only the individual, but it helps the CDC and the community as well. One of the things we're doing, if we do the IgA, IgM test on you, and that comes back positive, then that also indicates that you may have an active infection, even though you don't have any symptoms. And so if that happens, we're going to do that PCR test that looks specifically for active infection. So we'll do the IgA, IgG, and the IgM, all three, or you can request only, specific ones if you'd like. But most of our providers are doing all three, and it gives us a good snapshot of where you are and where you've been and maybe where you will be, and just allows us to provide a much better level of care for you. Continue to follow the instructions that are given by the governor and other local officials. Continue that social distancing, wear the masks where you've been instructed to do so, carry hand sanitizer, wash your hands as much as possible. Don't get complacent. While we feel like that we're really on the uptick here, it's really important that going forward, everybody continue to do those things that will minimize exposure and contact to other folks that may very well be infected or keep you from infecting somebody else. So the more we can flatten that curve, the better off we're going to be as a community.